I'm Dr. Ed O'Brien with MUSC Health, and we have some great news for you. Starting soon, you will be able to access care from a trusted MUSC provider 7 days a week, 365 days a year, anytime, anywhere through the MUSC Virtual Urgent Care platform. Thanks to your partnership with MUSC, your business is providing this care to you and all your family members free of charge for 1 year. This is an amazing service. It allows you to treat over 40 different conditions, really 40 to 50 different conditions, from the comfort of your home, wherever you like, on any device, iPad, iPhone, Samsung, whatever, as long as it's got the internet from wherever you are. Let me briefly just walk you through how to access these complimentary visits so that you can enjoy this throughout the whole year. The first thing you're going to do is either you can just Google the website, MUSC Virtual Urgent Care, or you can type in the web address, which is muschealth.org/virtual-care. Very simple. Once you do that, you'll get to this site that looks just like this. You'll click on the main button on there that says Get Care Now. So click on that. You'll come to a screen like this. At this screen, you're going to create an account. Okay? You're going to click on MUSC Business Partners because Charleston County School District is an MUSC business partner. You'll click on that, hit Continue, and you'll see your name listed right here, Charleston County School District. After that, you're just going to come down here and register like you would for any website, any doctor's visit, just putting in your name and your email address. Make sure to use your business email address because that's what keys the computer in to make sure the visit is free for you and your dependents. When you are registering, it will send you a confirmation email. Once you've registered on here, you'll click on that link and that confirms your account. Once you've created an account, you can go back to the main page, the main landing page. You'll come to something like this, and when you're sick, you can say, I'd like to start a visit. So let's pretend everyone around us at work has the flu. Flu season, I know it feels like it just ended, but it's coming back. So this fall, let's say your neighbor in the desk across from you has the flu, and you didn't get your flu shot yet, and you definitely don't want to get the flu, okay? So what you're going to do is you're going to start a visit. Then you're going to log back in with your work email and the password that you created. Then you'll come to a screen a lot like this. It'll say Patient Selection. This is where you register, this is where you'll show up and your dependents. So if you put a child or a husband or wife or a dependent here, you can add them onto here and choose them. Every dependent needs to be registered under your account to get the complimentary service as well. So you'll click on yourself, and then you'll say, I want to start a new visit with a virtual urgent care. You'll see some numbers down here with prices. Don't worry about that. It's complimentary. So click Start a New Visit. You'll need to agree to some terms and conditions. We'll also need to make sure you don't have a serious health problem like chest pain or shortness of breath. So you just click on No there. And then you'll get to the main screen. This is where you choose what condition you may have. Now, there's a lot of different conditions on there. Respiratory infections, eye problems, injuries, insects. You can feel free to click on any of these to see what's listed under each major category. For example, under travel medication, you can get motion sickness prevention, malaria prophylaxis. If you don't see something up there that meets your needs, you can always click on this button down here. It says, you know, all of these are great. There's 35, 40 conditions up there, but that's not really what I'm calling about. I need something else. I need a refill on my blood pressure medicine, for example. Click down here, click Select, and then you can contact us by whatever means you like, and we'll take care of that issue as well. Now, at this point, I want a medication to prevent an illness because my neighbor has the flu. So I'm going to click on Flu Prevention, then hit Select. Now, what you're going to see here is an interesting screen. We have 4 different modalities by which to cure your flu, or make sure you don't get it in this case. We can do an online interview, and this is what is the preferred method to get treatment. This is where you go through and actually access and answer questionnaire format. It's kind of like yes/no questions, almost a choose your own adventure, and then all that information gets sent to the provider. That takes about 5 minutes. We also realize some people like to talk on the phone, so we're happy to do a phone call. Also, some people like to do the video chat, like a FaceTime. We're happy to do that. Just click video call. Finally, most people these days are texting, as you know, so we also have a live chat available for text options. Today, we're going to click on the online interview, the most popular option. What it's going to do is ask you a series of questions to make sure you don't already have the flu and to see if you need the flu prophylaxis medication to prevent the flu. So it's just asking you questions. When were you exposed? Do you have the flu? Did you get the flu shot? Those kind of questions. And then it's going to send all this information to your provider. As you can see, it asks you a couple extra questions, like how much you weigh. It's going to ask you about your allergies and what medicines you take. You can plug in whatever medicine you take right here. Just type in whatever it is you take on a regular basis, say a blood pressure medicine. It'll then be stored in the computer, so next time you come in, it'll already be there. So I'm going to confirm that I currently take that one medication below. Allergies, same thing. Put in your allergies. They'll save in the computer forever. Confirm your allergies. Continue. And then you always have a chance to enter more information. So say you want to tell your doctor, hey, Tamiflu worked well for me in the past. Feel free to type that in here by clicking yes. So once you've done that, we're going to send you to a screen that says we may contact you in another way. Just click yes to that. And then that's it. Your visit has essentially been sent to the doctor. You're done. That took less than a couple minutes to submit that online questionnaire. Sometimes you'll come to a screen where there's a payment screen. Don't worry about that. It won't happen with you. You do not have any kind of payment. I'll enter a promo code here. So at that point, the interview is you're going to get a note that says interview sent to provider. Then you can go back to your dashboard and await for the provider to send you a notification. Now, when the provider sends you a notification, it's going to send you an email or a text message, however you decided, saying, hey, your doctor, your MUSC doctor has looked at your visit and has a diagnosis and treatment plan available for you now. This is going to be the same thing as if you did on a phone call, any of that kind of stuff. You'll hang up, the treatment plan will come back to you. So it's going to come up here and it's going to say, hey, I got a treatment plan available. I'm going to click on it. You'll log back in, click on that, and it'll say exactly what happened. It's going to say, hey, based on the information you provided, you are eligible for flu prevention medication. Here's the medication we're prescribing. Here's what to look out for. Great. So then what you're going to do is say, okay, how do I get my medication? All right, all I have to do is click this button right here that says fill prescription. Click. Make sure to allow computer access to your current location. And then all the pharmacies near you are going to pop up. You can just simply choose whatever pharmacy you want to, click that pharmacy and click send prescription, and the medication will be sent to that pharmacy. Otherwise, you can come up here and search whatever pharmacy you want and send it to your favorite pharmacy. The prescription is sent electronically and is done within just a couple of seconds. From start to finish, we average about 5 minutes for a visit to be started by you and completed. And then, thankfully, our average response time for these visits is 5 minutes as well. So you can have your entire visit complete under 15 minutes, really closer to 10 minutes, which is pretty amazing. That's a lot quicker than you could get in a car and drive to your doctor's office. Also, we feel it's beneficial to avoid trips to your doctor's office because at certain situations, you might get sick in the waiting room. We want to avoid that. We want to avoid contact. And also, if you can stay at work and not have to take 2 hours off of work to travel somewhere to an urgent care or something, we feel like that's very beneficial. Also, all the information is available to your electronic medical records should you desire. We really appreciate this opportunity. This has been extremely popular at MUSC, where we've rolled it out to our own employees. And we thank you for allowing us to bring MUSC's world into yours. And again, I'm Dr. Edward O'Brien, and thank you so much for this opportunity.